This podcast is for informational purposes only and is not intended to replace professional medical advice or be a substitute for therapy. Please contact a mental health professional as needed. If you are in need of urgent or emergency health care, please contact your medical and/or mental health provider, call 911, or go to your nearest emergency room. The information presented in this podcast does not reflect the opinions of those with whom Dr. Ellick might be affiliated as an employee, consultant, or colleague, past or present. Good morning and welcome to another episode of From Mayhem to Mindset with Dr. Laura. I am your host, Dr. Laura Ellick, and I have a guest today who, after I read you her bio, you're now going to understand why I am so not worthy. So please meet Tricia Youngs. So Tricia Youngs is an LMHC MCAP QS, which is a qualified supervisor for people who do not know, a speaker, author, trainer, licensed therapist, and coach. I'm tired already. For over 26 years, Tricia has helped hundreds of individuals, organizations, and corporations improve their functioning by providing mental health counseling, life coaching, and empowerment services with trauma recovery and interpersonal dynamics. Personally trained with the leading experts in trauma and addiction, such as Pia Melody, Bessel Vanderkolk, and Patrick Carnes, Tricia received her master's degree in human relations from NYIT in 1998 and began her clinical career at the Sexual Assault Treatment Center in Fort Lauderdale, Florida. Since then, she has worked at all levels of care in the mental health and substance abuse industries. Woo! Tricia, hello.
Hello. I've been busy. I need a rest.
Yes. Listen, it is such a pleasure to have you here. You know, I've talked about this with other people that the industry in South Florida is big, yet it's so small. Mm-hmm. So there's a circle of people whose names that you may see over and over and over, but you just never meet them at events, sure. Right? It's only been pretty recently that I've met you in person.
Yeah, we had dinner one night.
Right.
Tremonti's, I think.
Right. Yeah. And it was amazing. And that just started like, wow, look at all of the things that Tricia's doing. So you're here today also because you just wrote a book. And listen, I've written a couple books. I've written a book chapter. Writing a book is like having a baby.
Absolutely.
Right? You think, eat, breathe this baby for 9+ months. So how long did it take you?
It took me like that dedicated in the weeds, doing the writing. I'm going to say about 11 months. Mm-hmm. I spent a bunch of time before I actually got busy doing some prep work. But the actual, let me get up at 5:30 every morning, hit the keyboard for 2 hours, dedicated time on the weekends. It was really like about 10 months.
That's a long pregnancy.
It was a long pregnancy. The writing it was obviously a lot, but then the editing process, going back and forth with the edits, that was another, just as soon as you think you're done, it's like, oh, okay, now we're getting down to the next stage. And then doing the citations actually took me like 2 months.
That's the hardest part. I remember that with writing my dissertation. That was like the most tedious part of the entire thing.
Oh my God. I was telling my friends and anybody who'd listen, it's a good thing I live in a 1-story building because if I didn't, I would jump out the window and it would be over. I was just like, what was I thinking? Almost
it is
like,
a major
almost like
undertaking.
When I did natural childbirth. And
what was I thinking? Give me the epidural.
Yeah. Let me change my mind. But you're already too far in.
Right. So I've been able to read. I haven't finished the entire book because I had this pesky surgery that got in the way, but I have it on my Kindle. So I get to read a few pages here and there. Uh-huh. Your story is so compelling. Mm. And so can you just give a little hint, a small summary, which I'm asking almost the impossible, of your story. And you also have a really interesting story about how you decided to write the book too. And I think people would be really interested to hear that sometimes we need that little push from the universe.
Absolutely. So my story is, it's colorful, as people have told me, with lots of different chapters. Basically, it's a story of a little girl that grew up in a lovely home, a lovely environment, and who there was stuff going on in the background. I come from a home with a lot of love, a lot of alcoholism, and I come from a part of society with a lot of alcoholism. And I had sexual abuse from a godfather who was a very trusted person to our family and really put in charge of a godfather is supposed to be caretaking your spiritual growth. So he sexually abused me from a very young age. That impacted everything in my life. Like everyone, whoever's been sexual abuse, it impacts everything in your life. So I grow up and I develop alcoholism to numb all of the discomfort with that.
Can I stop you one there just to ask a question about that? Do you think if you didn't have that genetic history of alcoholism too, and you saw it in your household, do you think alcohol would have been your coping strategy, or do you think you might have found something else?
Well, I found cookies before I found alcohol.
Right. That's true.
Right?
That's
So
true.
I found cookies before I found alcohol.
Yeah.
So that helped to numb some of the pain. And then the alcohol, it could have been anything.
Yeah.
All I know is it was uncomfortable living in my body.
And you needed something.
And I needed something to help me live in my body.
Mm-hmm. One of the things that I think is so amazing about your story is you are so gracious in talking about your parents.
Mm-hmm.
You give them a lot of leeway, which many people would not do. Like you make it very clear that yes, they had their issues and they were also a product of everything that they were dealing with as well. And I don't hear too many people put that perspective.
Yeah, but I think that it's interesting. And as I eventually got sober, and I did my work, and I was initially, I was so angry. I mean, just so, so angry. And I remember this wonderful gentleman, Ben T, would come to me. He goes, until you forgive your father, sweetheart, you're not going to have a healthy relationship with any man.
That hit home, huh?
That pissed me off. It really pissed me off. I was like, what are you talking about? And I was like, no, I am not going to let the wounds of my life block me from having a productive, successful life.
That's amazing. So you started with the cookies, shifted into the alcohol. Right.
And dabbled with some weed and some stuff, but really it was mainly alcohol for me.
Mm-hmm.
And that alcohol was my go-to, my BFF. And it was very common in the area that I grew up.
Mm-hmm.
I mean, Irish Catholic, very
it's part of the culture.
Very, very, very cultural,
Mm-hmm.
very cultural. So, but what I realized when I went to college, well, first I drank my way in and out of college.
I saw that. Yeah, I read that.
In a year and a half. It was like,
mm-hmm.
that was a quick trip of just sheer chaos for me.
Mayhem.
Just mayhem. I mean, just mayhem for me. And, eventually it didn't work. It stopped working. I mean, I needed more and more alcohol to stop the flashbacks.
Mm-hmm.
Because the flashbacks were just nonstop. So I needed more and more alcohol. And then eventually that doesn't work anymore, right? That just doesn't work anymore. And so
what switched for you in your head where you recognized, all right, what I've been doing all of these years does not work. I need to find a different way. Was it a moment? Was it someone saying to you, Tricia, you got to do it?
Well, so in terms of the the alcohol, which was the first adaptation to fall. It was really interesting. I was in my condo, my parents' condo, not too far from here, a couple miles from here, one night, drinking all alone because the party was over. Yeah. I wasn't the party girl anymore. I was drinking all alone in my condo, and I went to go get some ice to put in my drink, which was kind of funny because I wasn't using ice at that point, And I saw in my reflection in a mirror, and I was like, oh, it's so sad. That woman, that lady, she's so sad. If she was here, I'd invite her to my party. A little delusional.
Yeah, right? You had a little too much that night.
A little delusional. Mm-hmm. And then all of a sudden I realized that moment of clarity came, and it was like, holy crap, that's me.
Mm-hmm.
And then a little bit after that, I had a phone call from a friend from out of town. And it was like I was outed.
Mm-hmm.
I was outed because I had done a pretty good job of keeping it under wraps. Because once my drinking became really unmanageable, my behaviors became unmanageable, I stopped going out and I started just doing it in.
The isolation.
So I was caught. And so because I was caught and I was exposed, my ego took a hit, and I went to AA the next day.
Mm-hmm.
She said, you might want to go to AA. So one of your drinking buddies tells you to go to AA, it's probably time.
But you listened.
Yeah, I listened.
That's the interesting part, is because you know how strong it is for people. No, not me, or I'm fine, or I can do it myself. So what was it about what your friend said that really hit you?
I think it was about being exposed. I think it was about the shame of being exposed.
Well, you grew up with shame.
Exactly. I grew up with doses and doses and gallons of shame. So it was like, whoa, this being the exposure and the accountability. It's like, oh, now somebody knows my secret and they're going to follow up. They're going to follow up with me.
So that's really interesting, because if you look at the early part as you're telling your story, you tried very, very hard to be the good girl. Absolutely. And to do everything right. And so even as you first got into AA, it was, I got to be the good girl because they're going to follow up on me, so I better do this.
Oh, absolutely. Absolutely. And I wanted to work. When I first got to AA, I was very feisty. I mean, outwardly, I was the good girl. I was nice and happy and pleasing and everything. My internal voice was scrappy and resistant. And, you people are crazy. I'm not doing that. What do you? And then I would go and I would do what they told me to do.
Were you feeling it, or were you just doing it?
I was definitely feeling it.
Okay, so when you went to AA, it was from an external motivation piece. But when you got there, you were actually trying to work it. It resonated with you.
Oh, absolutely, absolutely. I was broken. I mean, I was broken. I was very, very fragile. I had no emotional regulation skills whatsoever.
How would you? You'd never learned them.
All over the map. I cried for the first year and a half every day. I mean, just sobbed and wailed and shook. And I remember there was a couple ladies, these two old ladies. They're probably my age now.
I wouldn't say old lady.
Yeah, right. But I was 26, right? So I looked at them and they were like ancient. I heard them in the back. When is she going to stop crying? When is she going to stop crying? And I just cried forever. But it needed to come out. It needed to pour out of me. And about 5 years ago, I ran into one of those ladies.
Oh, no way.
Yeah, and now she really is old, right?
Yeah.
And I looked, I said, I stopped crying.
Did she remember you?
Yeah.
Oh my gosh.
Yeah.
Wow.
So
that's a great story.
That was pretty cool.
So you have an impressive list of people that you've had the opportunity to study with. And of course, unfortunately, Pia Melody just passed away. Did you know that was coming, or was that a shock to you too?
It it wasn't in a horrific shock.
I mean, when
she
someone
was
gets
in
a little
her-
bit
yeah, she
older,
was in-
yeah, it's
you're
not,
right.
yeah.
She had retired. She was no longer training. She was no longer teaching. She was no longer doing clinical work. She had stopped that a few years earlier. And so I knew that she was slowing down. I mean, I knew that. I knew that the last time I had seen her at one of her birthday parties that we were at. And but it was really impactful for myself and her people. We used to call ourselves, well, we still do, our PIA people.
Oh
Because
my
we
God.
trained and we did our trauma work together. We spent hours and hours and hours.
Now, where was
each
that?
other.
Where was she at that time?
In Arizona, in
Mhm.
Wickenburg, Arizona. She was at the Meadows.
Yes. Okay.
So we would go out to Scottsdale, we would go out to Wickenburg, and we would just train, and we would just kind of like sit at the feet of the master, the most humble person. I mean, just very, very humble, but a wise sage. Like, I don't have any heroes. I really don't. But I do have mentors. And I fortunately was able to share that with Pia many times about how grateful I was for her mentorship and how grateful I was for her impact on my personal life. And she gave me a practice. I mean, she gave me all of the tools that I needed to go out and help other people.
Which is
Like,
what you
she
do
took-
right now. That's
Like,
what you do.
She
Yeah.
took her wisdom and said, okay, here it is. This is what you do. And it was a roadmap to really be able to help people. So she gave that to me and others as well. And I heard last week, it was interesting. I was at an AA meeting last week. And yes, I still do go to AA.
Oh, I want to talk about that.
Okay, all right. But I heard a guy who was saying, you know, when I first came here, they told me to sit next to the old timers because they had so much wisdom to share and they're not going to be here for long.
Mm.
And when I heard that, I got such chills because I was like, yeah, my Pia, that wise sage, just left this planet. But fortunately, I have enough of her voice, and enough of her teachings, and I have recordings and everything. So I was like, wow. And then there was another person, an older woman, who was my psychodrama mentor, teacher. And she just passed last week.
Oh, wow.
So it was like these
Two major losses.
Yeah, these two really influential, important people in my life that passed. So it's like, wow.
So I often talk about, the 3 C's to recovery. Consistency,
Mm-hmm.
no complacency, and connection.
Yeah.
I'll probably write about that at some point, but
That's really good.
yeah. And so it sounds like you do very well with consistency and not being complacent because you're still going to AA. And that's what I tell people all the time is complacency is probably one of the most important things. That will kill you if you become complacent. You always have to be mindful about where am I at?
Yeah. And I go to AA. I don't go every day.
Right.
I go once in a while now because I've built my recovery. But an interesting story, I was 25 years sober or so, something around that. And I'm driving through the desert to go to a training. I pass by a motorcycle bar. Like, okay, motorcycle bar. Okay, great. Drive a couple more miles, another motorcycle bar. I get this thought, I can go in there. Okay, keep going. Another motorcycle bar, a little, skanky little place. And,
Interesting. I guess there's a lot of them in Arizona
I
and the
know,
desert, right?
It felt like it.
Yeah.
And I was like, I'd go. Who would know? I work for myself. Even if I don't go to the conference, who's going to know? Nobody would really know, right? And I'm thinking to myself, I was like, what? What the heck? I was at the height of my career, a successful marriage, fabulous daughter, wonderful friendships, financially secure. And all of a sudden, I'm thinking of going into a skanky motorcycle bar. Even when I was drinking, I didn't go to skanky motorcycle bars.
But do you see how
wasn't
sneaky
that
that could
wasn't
be?
me, right?
Yeah.
But that was like, oh, cunning, baffling, powerful, and patient. Very patient. And it's, in many ways, I think it's like spiritual warfare. The enemy wants to take me out because I do a lot of good for the universe. Right? Through the work I do. It's not like me, but, I'm an instrument. I'm used as an instrument for change. And so I'm like, yeah, no, not today. Not today. So.
And that's what I tell people is staying on top of those thoughts because they will come up at very sneaky times.
Oh, they will.
So you're saying 25 years sober.
25 years sober. Like what? Like,
And those are the times where if people aren't on top of it, they may think, yeah, what the heck? Let me just go in there.
What's it gonna hurt?
Yeah, what's it going to hurt? I can have one.
Right.
And then before that, you're off and running.
Right.
And we've seen that with some losses this year from people in the community as well. We've experienced some significant losses.
Exactly. Yeah. So I take my recovery very seriously. I don't think I'll ever really drink again. I mean, I don't, but I also know that it's patience. So I just and people say, well, don't you think now that you've resolved all your trauma, you've done all your work, that you could drink? Maybe it was a result of the trauma because you needed it so much to calm down your nervous system. Sure, maybe, but why would I want to at this point?
I'm always baffled by that question that people ask. Why are people so obsessed with alcohol in our country? And that if you're not drinking, you're missing out on something.
Yeah. But people who follow my life, they don't even know that I don't drink. Because I'm fun. I'm just fun.
Of course, we were at dinner together, and that was a fun dinner.
Right. I love life. I have joy. I love people, and I like to have fun. So a lot of people are very surprised when they find out that you don't drink. No. Oh, come on, you do. No, no. I just don't carry around this shame. So because the shame is gone, I can be free to be spontaneous and open. Right.
And have your real personality shine through. Because if we go back to the book, right, as a child, you had so many gifts and you had a light in you that was extinguished by the abuse, extinguished by Catholic school.
Yes.
It just, every step of the way, the little girl who wanted to shine
absolutely
just got diminished day by day.
I just kept getting emotionally whacked. I mean, I wasn't physically whacked,
right?
But I was emotionally whacked. Every time I turned around, it felt like I was getting emotionally whacked again. And so you just get smaller and smaller and smaller and smaller. The Catholic school, I learned that I was unacceptable. That I was just unacceptable because I made a mistake on my homework in first grade, and she shamed the shit out of me in front of the whole class, and that really stuck in terms of mindset. That stuck with me throughout my life, and it's interesting. I had a job interview down on Cypress Creek Road in Fort Lauderdale 30 years or so ago, and it was to be a stockbroker. And why I was interviewing to be a stockbroker, I have no idea. But I went on the interview, and halfway through the interview, I was saying to myself, yeah, I don't want this job. But I was polite and, did the interview, and thank you very much and everything. And as I was leaving, he said, one more thing, just take this assessment for us before you leave. Everybody does.
Yeah.
And I wasn't... I wasn't healthy enough at that point in time to say thank you, but I don't want the job, so we can skip that. I was still into very people pleasing. Oh, like, okay, be a good girl. So I took the assessment, and as I'm doing it, I'm like, yeah, I could be at the beach in 20 minutes if I fly through this, right? All right, so I did that, flew through it. A couple of days later, got a phone call. You got the job. I'm like, oh, thank you, but I don't want the job. He says, no, you scored the highest on the assessment of anybody.
Oh, that's so funny.
Top percentage. It was a math test.
Mm-hmm.
So it was a mathematical aptitude test, right? All this time, all those years, I told myself that I was so unacceptable, that I was dumb, I was an idiot. Like all of this, from all of that, scored really high. So what that taught me is the things that we tell ourselves, the power that they have. Like I wasn't invested in the outcome. I didn't want to be there. I wanted to be at the beach. So all of that self-loathing, those self-limiting beliefs were not in the building.
Most people don't know this also, but we learn this when we're learning how to do psych testing and IQ testing and stuff like that, is that anxiety has an impact on how you score on math. So you had no stakes. It was a no stakes, you didn't care what the outcome was. So you had no anxiety. I'm just going to do it and get to the beach.
Exactly.
Mm-hmm.
Exactly.
Mm-hmm.
I mean,
Fascinating.
Anxiety can really rule our life.
Mm-hmm. Mm-hmm. So tell me a little bit about your thoughts on Gabor Mate. I wanted to go see him so badly. I think it was either my daughter was in town or I had just had the surgery. Uh-huh. You consider him to be a huge influence on you?
Yeah, the reason the first time I saw Gabor was at Global Exchange a couple of years ago. And I liked his work. I had read When the Body Says No, which really talks about the impact of unprocessed emotions, the impact that it has on your body. Right? And it was a very good book. I thought it was an easier read than When the Body Keeps Score.
Mm-hmm. Yes, absolutely.
So it's much more user-friendly.
I would agree with that.
Right? So I went up to him after his presentation. I said, got something really interesting to tell you that you'll probably find interesting. And he goes, what's that? I said, I just got over, recovered from throat cancer. And he goes, oh, I'm sorry to hear that. Very, very kind of like dry and polite. Sorry to hear that. I said, yeah, that's not the interesting part. The interesting part is I tried to strangle myself when I was 6 years old. I tried to kill myself. And
he must have loved that.
Oh, yeah. He was like, whoa. And he goes, okay. And then all of a sudden he paid attention.
Right? Of course.
And he said, well, what has been left unsaid? What needs to be said? I said, Gabor, I said everything. I mean, at this point, I'm 35 years sober. I've done 20 years of therapy. Everything's been said, right? And he goes, what has been left unsaid? I said, I told you, I've said everything. I've been filleted. It's been put out there. I'm good. He goes, what has been left unsaid? I was just and I said, well, I haven't done it here, on this stage.
Oh,
here.
You just said
it. And then he said, well, you better get writing.
And that's how the book was born.
That's how the book really came. That really throttled me into, okay, you need to sit down and you need to write this book. You need to get it done. When one of the wisest sages of our time gives you a direction,
you better do it.
You better do it. Mm-hmm. And there have been other people along the way who had encouraged me to write, asked me to write. And so I'm like, okay, I guess I'm writing. Mm-hmm. I guess I'm writing. Mm-hmm. And I wanted to write the book, not because, oh, wow, look at me. I went through, I went through all this stuff. And I overcame it. Wow, look at me. Aren't I great? Not interested in that. I wanted to write the book to give hope to other people who have gone through difficult situations, to let them know that how to get through. And I also wanted to write the book to empower and equip people who either have people in their lives who are struggling with alcoholism, with trauma, with difficult behaviors, for them to have like an inside view of what might be going on in their loved ones' lives. Also for clinicians, new clinicians, and even seasoned clinicians, to have an inside, a front row seat of what it's like, what their client might be going through. Because the books don't always talk about it.
No,
they don't. And so, and to inform therapists what not to do. Because there's a lot of people who say they're trauma informed and they work with trauma and they really don't, or they're doing more damage than they're helping. So don't go somewhere if you're not trained. And you can't lead I don't know who originally said it, but somebody said you can't go further. You can't take anybody further than you've been. So I'm a huge proponent that every therapist working with humans needs to do their own emotional work.
It's essential. It's absolutely essential.
I think it should be a legal requirement.
One of the things that you said, though, that's so interesting from a spiritual perspective, I'm thinking throat chakra, right?
Absolutely.
Right?
Absolutely.
You were blocked from speaking your truth. And as we know, one of my specialties is autoimmune disorders. And there is a high proportion of people who have experienced trauma who have autoimmune disorders.
Yes.
And have eating disorders as well. The co-occurrence it's just insane. And
Absolutely.
That piece has not been looked at. When I talk to people about that, when people come in to see me or for the eating disorder program I work for, when we have people coming in and they're complaining of these GI symptoms and pain and joint pain and aches and stuff like that, so other people are like, why are you saying they should go to a rheumatologist? It's clearly because they're too thin or they are weighing too much. I'm like, no, we have to see what the body has actually been through because the body is giving us a message.
Right.
And it's not, in this case, it's not about the food. It's about the chronic inflammation that comes from chronic stress and chronic trauma. That's it.
1,000% agree.
It makes sense to me, but when I explain it to people, they say that they've never even heard that before.
But it's like common sense.
But maybe it's common sense because we know it.
We know it.
Yeah.
And we've experienced it. And I've worked with so many people who have autoimmune disorders. And it's about that throat chakra, what you need to give voice to. Now, does that mean everybody has to go out and write a book and give it? No, but you don't have to do anything. But if you want to feel better, it's important that you give yourself permission to give voice to your truth.
I'm running a group right now called Finding Your Truth. And it's I'm running the younger adolescent group. And it's amazing to see how many people are also not connected, their head and their body.
They got to shut that off.
They got to shut that off.
Sending me too many uncomfortable signals down here.
And that's some of the first work that I do with people, whether they have an addiction, eating disorder, whatever is the coping strategy is to disconnect. And look, the medical system also disconnects the head from the body. So just think about it. If you have inflammation in your body, don't you think you have inflammation in your brain?
Absolutely.
So some of your depression, some of your anxiety, some of the other stuff that's going on could very well be inflammation. We just don't know.
Yeah, and also the insurance industry separates it.
Of course. Well, the insurance industry runs the show.
Right, exactly. Right? We have mental health and substance abuse over here. Oh, and then you've got your medical insurance over here. I'm sorry, that makes no sense.
It makes sense. And there's different coverage for, right. Exactly. Right. So Tricia Youngs, it has been an amazing experience having you here. Tell everybody where they can find you and where they can find your book, because you didn't even say the title of your book.
So the title of the book, it's Rescued: Hope for the Shattered Heart and Soul. And in this book, one of the things I talk about is the rescue angels that came along the path of my life. And also, you really have to rescue yourself, but you can't do it alone.
That's the connection piece, right?
Exactly. You cannot do it alone, but you have to rescue yourself. You have to be the one that does the work. You have to be the one that reaches out and accepts the help and takes the action. And that's the mindset piece. The other thing that I love to tell clients is that I'll be damned if what they did to me, whoever the they is, whether it be somebody in childhood or, an ex-husband or a boss or whatever, I'll be damned if what they did for me is going to rob me of my joy.
Mm-hmm. The little stubbornness in there, which
Absolutely.
I have too. And that I think is one of the keys to resilience. So where can people reach you? Someone wants to call you, ask a question, become a client?
Phone number 561-886-7985. Website, www.triciayoungs.com. You can find me on Instagram. You can find me on Facebook. You can find me all over the place.
You are not lost. That's for sure.
I am not lost.
Thank you so much, Tricia. It was a real pleasure. And to reach out to me, Dr. Laura Ellick, you can find me at 516-635-6186. And my website is www.lauraellick.com. And of course, like Tricia, I am plastered all over social media, usually at Laura Ellick Reel. And if you want to see the video of this podcast, check it out on YouTube at Laura Ellick. So tune in next time for another episode of From Mayhem to Mindset with Dr. Laura. Peace out. Thanks for joining us on From Mayhem to Mindset. If you found today's episode helpful, be sure to subscribe wherever you get your podcasts and leave a 5-star review. It really helps spread the message. Want to dive deeper? Check out my book, Wisdom from the Universe, available now on Amazon. And if you're looking for a speaker to inspire and transform, I'd love to connect. Visit www.lauraellick.com to learn more. Remember, you don't have to just survive, you can thrive. See you next time.